on the cusp of something new and something bold.
I'm a psychiatrist. And what I've seen through my years as a psychiatrist is a lot of psychiatrists don't have the religious training, the understanding of spirituality, which is where spiritual competency comes into play. And a lot of clergy need additional mental health training. We're both dealing with the same difficult situations of psychosis, of spiritual experience that may get out of control, of drug use, whatever. And so both sides, we'd like to come together, be available, but have a new level of knowledge that isn't being included in terms of the spiritual competency.
What is 988 when clergy are involved?
We see so many opportunities where there are 911 calls and it doesn't end well. Those are members of our community, members of families, and I just wanted to make sure that as a clergy person, I do everything I can to work with community, work with law enforcement so that don't happen in our community. Secondly, I want to make sure that people are aware of what happens during crisis. Many of our community don't know what to do except call 911. And so we want to make sure they're aware of other opportunities, who else they can call, what other conversations they can have, make sure they're educated on what programs are available to them.
Well, most hospitals aren't equipped to treat a spiritual crisis. There may or may not be a chaplain on staff, but it may be actual medical malpractice to diagnose and treat something that doesn't exist. You can't say anybody that shows up with a headache has a brain tumor.
I do think that the area of mental health is a tremendously important area for us in the ministry to be able to address in these times in which we live. And speaking from our perspective in the church world, that I think it's something that we've been a little bit behind on, kind of understanding and also trying to prepare ourselves further to help many people this day and age who are facing many different type of mental health situations. So I'm the pastor here of Abundant Life Church of God, which is a church that we founded when I came out of college back in 1988. So I've been here 35 years and have a very multicultural, multiracial, multi-generational congregation. But we're seeing mental health needs in the largest proportions that I've ever seen them, in the 35 years I've been a pastor.
They had psychological problems that were often caused by spiritual components. I believe that one of the biggest, if not the biggest component of psychological problems for people is their spiritual life. Even though it's one of the smallest parts of the DSM-5 in the V code, it really is probably the most powerful part of the DSM-5. Just a couple sentences.
I think that clergy can be both supplementary supports for them, right? It is someone who can help give someone a sense of gentleness.
People come to clergy first when they have a mental health crisis. That far too often clergy are ill-prepared to be able to respond in a way that's appropriate. And we have lots of horrible examples of that, unfortunately. So I thought, here's a group of clergy, spiritual leaders, religious leaders, that at least put on their radar screen that there's a need to have mental health in partnership with religious and spiritual leadership. Mental health and spirituality do need to be partnered together.
People have spiritual or religious crisis, and we are trying to just make an awareness that that's not always psychosis, it's not always mental illness. Let's talk about 1, 2, 3 things that we've been trying to say. Something about, are you aware that there's actually a religious spiritual issue in the DSM? Like, this is not always, a hospital call. Can we bring clergy on? And maybe back to the how can I help before we react too quickly.
One of the things that I want to keep from happening is having this thing escalate into a bad place, or to have them get upset. And I think when you can go to them and say, listen, would you like it if I called someone a member of the clergy? Do you have an active church that you attend? when you can just engage that, you're kind of disrupting their thought process. Number one, you're making them think a little bit. They're not just spouting things out. They're actually stopping for a minute. And they're actually using this as a tactical pause as well, because the truth is now they have to go, wait a minute, they're engaging me on a different level here. And do I go to church? Do I have a pastor? Do I have, so they're thinking about that. And they may not, but the fact that you're asking those questions shows that you're engaged with them and that you're at least thinking on the same level. I have someone that we work with, and maybe it is or isn't possible, but maybe you work with someone that's in your agency that is a police chaplain or whatever, and you go, listen, I know maybe this person isn't of your religious background, but would you be willing to talk with them?
I don't think we're too far away from including chaplains and clergy in that. We don't want to overburden first responders, but we want to have that tactical pause before we just react and drive somebody into a hospital without any support.